Hello everyone, welcome to Health and Nutrition Studies. My name is Aaron. Today we are going to talk of adult respiratory distress syndrome, or ARDS. It is a severe lung condition that occurs when fluid builds up in the alveoli, which are the tiny air sacs in the lungs. This fluid prevents the lungs from filling with enough air, resulting in less oxygen reaching the bloodstream and, subsequently, the organs. ARDS can be caused by a variety of factors, including severe infections such as sepsis, trauma, pneumonia, aspiration of gastric contents, and inhalation of harmful substances. ARDS, also known as acute respiratory distress syndrome, progresses through several stages, each with specific characteristics. Initial injury phase, exudative phase. This phase lasts up to a week and is characterized by inflammation and the accumulation of protein-rich fluid in the alveoli, causing severe hypoxemia, which is low blood oxygen levels. Symptoms include shortness of breath, rapid breathing, and cyanosis, which is a bluish skin color due to a lack of oxygen. Proliferative phase occurs after the first week, lasting up to 3 weeks. Repair processes begin. New cells form to replace damaged ones. The fluid in the lungs starts to be reabsorbed, but the lung tissue becomes thickened and stiff, known as fibrosis. Fibrotic phase beyond 3 weeks. The lung tissue undergoes scarring and fibrosis, further reducing lung compliance and gas exchange efficiency. This can lead to long-term respiratory problems or chronic lung disease. Causes and risk factors. Direct lung injury can result from pneumonia, aspiration, inhalation of toxic substances, or near drowning. Indirect lung injury can be caused by sepsis, severe trauma, multiple blood transfusions, or pancreatitis. Diagnosis. Clinical criteria include the rapid onset of respiratory failure within 1 week of a known clinical insult or new and worsening respiratory symptoms. Imaging, such as a chest X-ray or CT scan, shows bilateral opacities not fully explained by effusions, lung collapse, or nodules. Exclusion criteria involve respiratory failure not fully explained by cardiac failure or fluid overload. Treatment. Oxygen therapy is used to maintain adequate oxygen levels. Mechanical ventilation assists with breathing, with settings adjusted to minimize lung injury using lung protective ventilation strategies. Prone positioning, or placing patients on their stomachs, helps improve oxygenation. Fluid management is crucial, carefully balancing fluid levels to prevent fluid overload while ensuring adequate organ perfusion. Medications, including antibiotics for infections, diuretics for fluid management, and other supportive medications as needed, play a vital role. Extracorporeal membrane oxygenation, or ECMO, is used in severe cases to oxygenate the blood outside the body, allowing the lungs to rest and heal. Prognosis and complications. The mortality rate ranges from 30 to 50%, depending on the severity and underlying cause. Complications can include barotrauma, which is lung damage from ventilation, infections, organ failure, and long-term lung damage. Recovery can be challenging, with many survivors experiencing long-term health issues such as reduced lung function, physical weakness, and psychological impacts like PTSD. ARDS requires prompt and aggressive treatment to improve outcomes and reduce complications. Multidisciplinary care involving pulmonologists, critical care specialists, and rehabilitation therapists is essential for managing this complex condition. Thank you very much for watching. Please follow and subscribe. See you in the next video. Thanks you.